Immunization is obviously a very important thing for saving lives around the world. And today we're actually at the highest immunization rates ever in history if we look globally. But of course, what we're seeing in the news is the big outbreak of measles that's going on around the world, and also of other vaccine preventable diseases, particularly in places that in the past have had good control of diseases. And, the question on people's minds is why? So measles is, of all the infectious diseases, the most communicable of diseases. If somebody had measles and was sitting here and left, and 2 hours later somebody else came in, they could actually catch measles from that. So to get the type of protection you need against measles, you need very high vaccine coverages. WHO recommends 95% as the level you have to have. And what's happened over time is there's been complacency. Why? We've done such a good job with vaccines that people have seen these diseases disappear. My wife actually is a physician. She worked in an intensive care unit in New York City. She's never seen a case of measles or tetanus or rubella. That's the power of vaccines. But with this complacency, coverage rates have begun to drop down. People have said, well, why should I vaccinate my children? I'm not sure these diseases are that bad. And with that dropping in vaccine rates, we've seen a resurgence. And right now, 49 of 53 European countries have actually had cases of measles. A vaccine that's been available for 50 years is safe and effective. It's just not getting to everybody. And that's the challenge. What's interesting is in the past, vaccine hesitancy, the concerns on vaccine, were not seen mostly in the developing world. Why? Because people in the developing world saw the diseases. Nobody wants their children to be sick or to become disabled. So they responded, they would go and stand online, they would walk long distances to get access. Of course, with the great progress that's being made there, they're beginning to see a reduction of diseases. But more importantly, what's really changed now is the access to social media. So literally, misinformation can move at the speed of light, and it can move through circles, it can move across countries, and it can move across the world. So if you're a mother that is concerned, is this vaccine good, should I take it or not, and you go on the internet, you can end up with an anti-vaccine site at a site across the world, and you don't have any way to know, is that good information, is it bad information? So one of the things that we're trying to do, and one of the reasons this conference is important, is to reach out to social media companies and to say two things. One is try to make sure there's not misinformation. And that's important. So intentional misinformation shouldn't be there because it hurts people. But that's not enough if you take off the misinformation. When somebody gets in touch, when somebody looks on the internet, it's because they want information. Can we direct them to sites that have reliable information? They can go to WHO, they can go to national pediatric societies, the US CDCs, lots of places you can get information, but we want it to be reliable, fact-based information. Of course, it is our job in the medical profession to make sure that everybody has the facts. And of course, there are new vaccines, there are changes in the science, and it is the job of individual physicians, nurses, counselors to be up to date on that. Does this uniformly work? Does everybody have the information? Of course not. But that should be our responsibility, to make sure there is continuing medical education and that everybody has the facts necessary, not only to recommend the correct immunizations, but also when people come with facts that are not correct, to be able to correct them and to steer them towards the correct activities. Now, why is this important? So the difference with immunization and other things is that in immunization we rely on something called herd immunity. What that means is if you vaccinate 9 people, that 10th person is protected because everybody else is vaccinated. Now, why is that critical? Some children can't get vaccinated. They've had cancer chemotherapy, they have immune problems, or the vaccine just didn't take. That child is protected from all the other children being vaccinated. When vaccination coverage rates go down, it not only imperils the child that didn't get vaccinated, but it imperils these other children. And that's why it's a more important societal issue and not just an individual issue. So it's not my job to tell Europe what type of legislation they should have.
From a personal standpoint.
Yeah, from my personal point of view, what's really important is that decisions of whether vaccines should be mandatory or not really needs to be left to each individual country, to each legislature to make those decisions. However, in making those decisions, you want to make sure people have a full understanding of what the value of these products are, the importance they have for public health, and why it is a global public good. That's the critical piece of information, because some of that's been lost. And so some of the movement is just a rights-based. I should have the right to vaccinate or not vaccinate my child. Well, that needs to be held into, the overall issue of, does your child, if it gets sick, have the right to infect and kill other children? That's a discussion that has to happen, and that's part of why it is a good idea to have these more global conversations.